here to do my NG insertion demonstration. First, I would come into the patient's room and let them know what we're doing. I would assess the patient's nostrils for any polyps. I'd ask about any septum deviations or past nasal surgeries. Then I would measure from the tip of the patient's nose to the earlobe, and then from the earlobe down to the xiphoid process. I would then take a piece of tape and put it on the tube to mark where I need to stop. And then I coil the tube so it's kind of rounded. Then I would put lubrication on the first 4 inches. And then I can insert the tube until the patient starts gagging. After I hit that point, I would give the patient a break, and I'd have an assistant have the patient start swallowing. And he would swallow, 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 swallow until the tube was where it needed to be. I'm using a mannequin, so this is as far as I can get it. I would then take my split piece of tape and put it on the bridge of the patient's nose and wrap one side around it, the tube. Now I'm going to check for placement. First I'm going to take 5 to 10 cc's of air and listen over the fundus of the stomach. I'd insert the air and listen for the swoosh. Then I would aspirate a little bit of contents and test on a pH strip. And if it's between 0 and 4, then I know it's in the stomach. Now that I know it's in the stomach, I can finish securing the tube in the patient's nose. Now I can turn on my suction and connect the tube. I would then take 5 to 10 cc's of air and put it in the blue tubing to get the tube away from the side of the patient's stomach. Okay, it's been a little while. I came back into the room and I've noticed that there's nothing coming into the tube, and I've assessed the patient's stomach and noticed that it's distended. So I might have to irrigate. What I'm going to do first is check for the placement of the tube. I would put 5 to 10 cc's of air in the tube and listen over the fundus of the stomach. But it's blocked. I can't get any air in. I can't get anything out. So what I'm going to do is take 30 cc's of water and turn off my suctioning and disconnect. I'm going to take 30 cc's of water and do a pumping motion until I can get the blockage out. Then what I'm going to do is take a new syringe and I'm going to hook back up the suctioning, and then I'm going to take 5 to 10 cc's of air and put it in the blue tubing to get it away from the side, the tube away from the side of the stomach. Now, it's been a couple of days, and the physician said that we can take the NG tube out. So first I'm going to do my checks. I'm going to take 5 to 10 cc's of air and listen over the fundus of the stomach and listen for the swoosh. Then I'm going to take a little bit of stomach contents, aspirate a little bit of stomach contents, and put it on a pH strip. Make sure it's between 0 and 4. Now I'm going to take 20 cc's of water and 20 cc's of air. At this point I've already disconnected the tubing and shut off the pump. There's a lot of bile in the tube, so I'm going to push the water through first to get rid of all the bile, and then I'm going to push the air through to get rid of all the water. I'm going to keep the syringe connected, and I'm going to take the tube out. I'm going to ask the patient to take a deep breath and just pull the tubing out. And that's the end of my video. Oh, I would provide good oral cares, and then I would do my documentation.